Thank you, everybody. Good morning or afternoon, depending on the time zone that you are located in. As Diana said, my name is Richard Aleman, currently Vice President of Pharma Tech Associates out of Hayward, California. Today's webinar will deal with new developments at FDA Office of Pharmaceutical Quality and Inspection. My first slide will be a picture of myself so that you know what I look like. Okay, enough of that. Let's continue, and what I'd like to talk about first is the FDA 5-year plan, which actually is the FDA's strategic priorities, which is a 4-year plan. It takes 1 year to prepare this. As you can see, FDA's responsibilities continue to fulfill the mandates of groundbreaking legislation. A lot of laws have been passed recently, including the Family Smoking Prevention and Tobacco Control Act of 2009, the Patient Protection and Affordable Care Act of 2010, the Food Safety Modernization Act of 2011, and the Food Safety and Innovation Act of 2012, as well as the Drug Quality and Security Act of 2013. In addition, the FDA has many regulated products coming from overseas, so it is keenly focused on the complexities of regulating in a global marketplace. And that is a key to this whole presentation. FDA was now focused on the complexities of regulating in a global marketplace. This document is a result of a lot of work by talented FDA employees, dedicated employees who contribute each day to the FDA mission to protect the health and safety of the American public and strengthen FDA's preeminent global reputation. As a regulatory agency that makes its decisions on the best available science while maintaining its far-reaching mission to protect and promote the public health, FDA considers itself to be uniquely prepared and positioned to anticipate and successfully meet these challenges. This document sets forth FDA's core mission and objectives, such as improving and safeguarding access to and making better informed decisions about the products FDA regulates. It describes in detail key strategies to help the agency fulfill its public health mission. And every 4 years, FDA updates its strategic priorities document, which describes how FDA will work to address complex, multifaceted, and evolving public health issues. I also want to emphasize what Diana said. At any time, if you have any questions, please feel free to write them down and present them as we're going through this presentation. Okay, the FDA strategic priorities for 2014 through 2018 document is divided into 2 main sections. There's the cross-cutting strategic priorities as well as core mission goals and objectives. FDA has 5 cross-cutting strategic priorities for the next 4 years. The first one is regulatory science. Well, what do we mean by regulatory science? Regulatory science is the science of developing new tools, standards, and approaches to access the safety, effectiveness, quality, toxicity, public health impact, or performance of FDA-regulated products. Tackling regulatory science and innovative needs improves the product development process by providing new tools, models, and simulations to test medical products, increase the quality and efficiency of clinical trials, as well as identifying and evaluating clinical endpoints and related biomarkers for trials in areas where optimal endpoints are lacking. Globalization. Well, we mentioned this a little while ago, but globalization, FDA finds itself that most of its regulated products, or a great deal of its regulated products, comprise a substantial component of the global economy. Food and medical products and their ingredients and components are increasingly coming from abroad. Today, FDA's regulated products originate from more than 200 countries and territories and pass through more than 300 U.S. ports.
the number of FDA shipments has more than tripled from 8 million import line entries per year a decade ago to more than 29 million line entries today. Globalization demands that FDA think, act, and engage globally. FDA's success in protecting the American public depends increasingly on its ability to reach beyond U.S. borders. FDA is working with many partners abroad and domestically to enhance responsibility for the oversight of safety and quality throughout the supply chain. FDA will continue to expand its regulatory presence and partnerships to build a stronger, more secure global product safety net. FDA is developing an international operating and comprising 4 primary areas in the international field, which includes information sharing, data-driven risk analysis, enhanced intelligence, and smart allocation of resources through partnerships.